It's a great pleasure to be here. I am Anna Yakusik, Data for Impact UNAIDS, and today I am excited to present to you our 2024 global update on HIV epidemic in infants, children, adolescents, and women. I would first like to acknowledge our director, Mary Mehi. She's here today. We are lucky to have her today. And she's leading our Data for Impact practice at UNAIDS. I would also like to acknowledge the Global Alliance on Ending AIDS in Children, since the content of my presentation is related to what we are working on together as the group. I would definitely want to highlight our country teams who collect and produce the data and the estimates with the oversight of the Data for Impact practice at UNAIDS. First and foremost, I would like to highlight that on Monday, 22nd of July at 10 a.m., we will be launching our new global report. It's called The Urgency of Now, AIDS at the Crossroads. We will feature new data on the AIDS response, and the report will demonstrate that ending AIDS as public health threat is possible by 2030, but the success is being threatened by various barriers, and including those of funding and those related to human rights. We are launching the second publication this year, focused specifically on pediatrics, and this is a joint publication led by UNAIDS, based on UNAIDS data, and it's called Transforming Vision into Reality, and it's focused on the highest burden countries and the countries hardest hit by HIV in sub-Saharan Africa. We are also launching this report on Monday, 22nd of July, in the morning, 9:30 a.m. So please stay tuned as we put some effort in describing the epidemics in those very high burden countries that I will not be able to present today. But I am excited that we've put together quite some effort into this publication. And also with thanks to Lean and all the colleagues here, because we featured many of your abstracts and publications and articles within this report in the sections related to recommendations and way forward. Thank you so much, Lean, for sending those. So let's start with some numbers. We would like to highlight in the beginning that there has been a tremendous success and progress made towards ending AIDS in children globally. And in 2023, since 2000, globally, vertical transmission programs have averted an estimated 4 million infections among children. In 2023, an estimated 1.4 million children and 1 million older adolescents aged 15 to 19 years old globally were living with HIV. Here on this slide, you can see the numbers by 5-year age group globally from 1990 to 2023. The number of children who acquired HIV in 2023 was the fewest since basically since the start of the epidemic. There was a 62% drop in annual number of children acquiring HIV globally between 2010 and 2023. The greatest declines in new infections were in sub-Saharan African region. In 2023, most new infections are concentrated in Eastern and Southern Africa, 43%. It's on the bottom of this funnel chart. And then and Western and Central Africa, the decline was 41%. Together, Sorry, it was not a decline. It's like a share of new infections globally in 2023, 41% in Western Central Africa. The decline in Western and Central Africa was less than in Eastern and Southern Africa. So together, those two regions in 2023 account for 84% of global new infections. However, the decline in new infections has slowed markedly in recent years, as you will see on the next slide. So reaching women with prevention of vertical transmission has not changed based on our new estimates in the last 10 years. So this means that fewer new HIV infections in women and wider access to therapy has led historically to dramatic decline in vertical transmission. However, coverage of services for pregnant and breastfeeding women has plateaued globally with rates at 84% in 2023. Western and Central Africa now accounts for about 41% of all children acquiring HIV globally. The overall decline in the number of new infections among children is due primarily to the steep drop in Eastern and Southern Africa, 73% fewer new infections between 2010 and 2023. The decline is much slower in Western and Central Africa, 44%, which now accounts for about 41% of all children acquiring HIV globally, as I showed in the previous slide. This is a stacked bar. We changed it this year. We normally had it vertically, but it's our stacked bar that everybody knows that shows the main causes of vertical HIV transmission. This is updated. These are updated numbers for the global level new infections in children by cause of infection, cause of vertical transmission, Eastern and Southern African region, and Western and Central African region at the bottom. So key factors contributing to continued new infections among children globally and also in those two regions include challenges relating to maternal access to therapy during pregnancy and breastfeeding. We also see new infections due to mothers seroconverting during pregnancy or breastfeeding, or dropping off treatment during pregnancy or postnatally. The distribution of those causes did not change dramatically this year from the last one. So some good news is globally the proportion of HIV-exposed children who receive HIV testing within the first 2 months of life has increased from 50% to 67% in 2023. As it was the last year also in Eastern and Southern Africa. This is the bluish line on top. The progress is higher. The coverage of testing in infants is higher than global average. Western and Central Africa is lagging behind and presented in lighter blue at the bottom of the slide. And Western and Central African region is specifically concerning within Sub-Saharan Africa and globally as well. So in 2023, moving to treatment estimates globally, only 57% of children living with HIV were receiving treatment versus 77% of adults globally. So this gap, even though you can see that children are presented in red on this line graph, even though the coverage is increasing in children 0 to 14, the pace of the coverage in adults is outpacing children, and the gap is the biggest since the start of the epidemic. Only 48% of children living with HIV globally achieved viral load suppression versus 73% of adults. In this slide, you can see HIV testing and treatment cascade for children and adults, 15 plus years old, global numbers by year, from 2021 to 2023. I did show this on purpose to show that the progress is good. The numbers are increasing overall. However, we can see that the knowledge of status in children is very low globally, but also in some regions. Definitely something to mention is that progress in some places varies from others, so you definitely have to look specifically at every country to understand the dynamics. However, globally, this is the picture, and we tried to also unpack it more in both of our publications to highlight where the issues are. An estimated 590,000 children globally were not receiving life-saving treatment in 2023. On this slide, you can see the gap analysis of pediatric treatment globally from 2010 to 2023, and apologies for that typo here. And you can see that this gap is decreasing because the number of children living with HIV receiving treatment is going up, those bars on the bottom of the slide, and the gap is decreasing. However, it's still quite big, and what we see from our estimates is that among these children, 60% globally were older than 5 years old. In addition, so we can see from the data that in addition to expanding early infant diagnosis in infants, urgent attention is needed to expand testing options for older children who may be missed by early diagnostic services or acquire HIV during breastfeeding. And we also covered strategies and some new strategies that are being rolled out in high burden settings and also in Western and Central Africa, where the burden of HIV in children is somewhat lower, but less success programmatically. We would like to highlight that those strategies that are being implemented in finding those children are being successful in some places where they are being rolled out. So something to note here. In the conclusion, I kept the conclusion quite broad because we touch on so many different aspects. We definitely can be inspired by the progress advanced by the coming together of the communities and governments, UN and partners. However, we definitely see some critical gaps that are undermining the progress. We see from the data, and also we describe in both of our publications that support that it is essential to support the gains in high-performing countries such as in Eastern and Southern Africa, while also drawing on the contributions of diverse partners to focus on addressing barriers and to swifter progress, and also the countries that are doing worse than Eastern and Southern African countries. Leveraging technological advances and sharing lessons learned on strategies for overcoming those bottlenecks and barriers. So that's why I'm really excited to be here to follow on the new developments, and we've tried to cover most of the game changers. Again, thank you, Lynn, for providing those in our publication. And there's a need to also increase access to definitely prevention, testing, treatment, and care for infants, children, and adolescents. We've also covered quite some information on older adolescents, 15 to 19 years old, in our Pediatrics publication, including on new infections, deaths, and treatment outcomes. We also highlight that the efforts require stepping up action on preventing and detecting new infections among pregnant and breastfeeding mothers, and ensuring treatment and support for pregnant and breastfeeding mothers, and especially young and adolescent girls and young women who are living with HIV or those who may acquire HIV. It requires tackling gender-based violence. We've also covered a lot of those aspects in both of the publications related to gender-based violence and issues related to human rights in those spaces and how they are affecting the outcomes programmatically. And we are promoting gender equality to protect young women's health and safety. And I think that's my last slide. And please stay tuned for both of our publications. And thank you for having us today here. Thank you.